Welcome, colleagues, to an Amen Clinic in your community, in your church. I just wanted to take this time to express and share with you the equipment and everything that's involved in our vision department. As you can see, kind of here we have everything that you see in your typical private practice. We kind of modeled it so that all we need is your expertise and your licensing, and everything else is here at the clinic for you to use. Just to briefly go over everything, we have minus cylinder phoropters at every station. We have a harvest acuity for the electronic acuity charts. We have an automatic lensometer, and we have the eye care tonometer for glaucoma checks. And typically, if you have enough volunteers that can pre-screen for you, then of course they will do that pre-screening for you as well. And then we have a camera, a retinal camera for taking images of diabetic patients, and we have an autorefractor as well. Like I said, everything that you have in your private practice, we have here. Except one thing I forgot to mention, the good old-fashioned direct ophthalmoscope. So if you have yours, please bring it and identify it with some kind of color-coded tape. If you don't have it, we do have the camera. We can still take images and view the back of the eye in case you don't have yours. We also have a great selection of frames on hand. Thousands and thousands of frames will be available for the patient. They will be able to take what they, according to the prescription that you're writing. Please do not have them use their own frames. Have them use just the frames that we have here that are available for them. We have an in-kind donation from Marchand Eyewear, so all the frames are from Marchand Eyewear. Exam forms, we're not digital yet, so everybody will have an exam form. We'll have the patient's label on top. I just ask that you continue to check to make sure that the patient's name, date of birth, and phone number are on the exam form. And colleagues, remember, this is a legal document, so you want to make sure you sign everything because this is the property of Amen, and it's a legal document. So in case the patient asks months later for a copy of it, they would be able to retrieve it, and it would have your signature on the bottom for a legal document. Then the actual prescription sheet itself, same thing. The label will be on there. Just verify the patient's name, date of birth, and telephone number. They'll also need you to sign it. Again, legal document. This goes to the patient at the end of the clinic. Once you're finished with the exam paper can stay. This goes over to optical with the patient. And once they pick out a frame, I just ask that you instruct the volunteers over there to do the simple dotting, putting a dot right in the middle of the pupil and then at the line at the lower lid for the bifocal, and leave those markings on the frame for us. And then we would just take the prescription, we'll fold it in half, we'll put it with the actual frames, we'll put it inside a baggie, and then we send it to the lab. It takes about 6 to 8 weeks before we send it back to the church for dispensing. Again, this legal document comes back with them around their glasses so that they can keep this in their own personal records. And as I mentioned, everything here, all the toys that we have with us to use. Contact lenses, we do not offer that services, but we do have cases and solution for them to remove their contacts so that we can get them a prescription for their glasses. But we don't do anything else with the contact lenses. All of the lenses are polycarbonate, single vision, or flat top lined bifocals. Unfortunately, we don't have the funding to process progressives or transitions, AR coding, or sunglass prescriptions. Just the basics. And I hope to see you and serve with you, and I hope that this gives you some reassurance of what we offer to the patients to know that we give quality eye exams in the Amen clinics. Thank you.